Hello, I'm Dr. Craig Stern of Pharma Pharmaceutical Consultants. We're frequently asked about specialty injectables, these drugs that cost a fortune in comparison to the tablets and capsules that you get in a prescription bottle. And how do you handle that? What does it mean? Why do they cost so much, etc.? I'd like to kind of address this is a very big topic. It's going to take us a lot of different sessions to talk about, but let me try and address it from its most fundamental of issues, and that is specialty injectables, or just injectable drugs, exist and started out as treatments for very rare diseases, often called orphan diseases, that treat a very small number of patients, frequently less than 20,000, and sometimes in some cases less than a few thousand patients that are found across the entire United States. And they're very uncommon in other parts of the world as well as in the United States. So it's not the United States has a small number where everyone else has a large number. The real issue here for specialty is that originally it was for treatments for these rare diseases. There wasn't anything else. You have to treat them, and if you could find a treatment for them, then so much the better, and we had a way to treat some of these patients where before they had nothing. As things move through time, however, and clearly up until the present time, we now have a series of drugs that are being used to treat chronic conditions, or have even taken very severe illnesses and turned them into chronic conditions. And so we're substituting some of those small molecule drugs that we could get in a bottle with tablets and capsules and cost maybe over $100 for a brand and about $20 for a generic or more, and turn them into some of these specialty medications that are made by biologic processes and certain biologic pressure cookers, and effectively change those from $100 into something that costs $1,500 a dose or more. Big money. But in effect, you're treating something, and it may be a better treatment than what we already have. There is a good deal of research that is going on in order to try and make sure that it is, in fact, better than something that we already have. But most importantly, if it's better and it treats something in a way that can't be controlled by conventional medications, then clearly we have a benefit that we have to address, and how are we going to then afford it? As we address this, we have several things that we have to look at. Number one, is it being used in the appropriate patient population for the appropriate conditions? Two, is it being used in an appropriate way, meaning there's guidelines for its treatment? Is it being used in that way, or is it being used in a way that's totally different from those standard practices? Third, and by the way, is a patient aware of what's happening when it's being used in a way that is different from conventional practices? Third is the specialty medication an approved one for the particular disease, or is it something that's being used because it might work, but there is no evidence to demonstrate that it will work, and more importantly, that we don't know what the risk is or what the downside severity or toxicity of the medication is? And finally, how do we deal with the cost? Well, there are methods, and there are current methods and some tools that have been developed in order to deal with that. So that one, you can check the medication against the diagnosis to ensure the fact that it is approved and that there is evidence behind it for that particular disease in a patient that is like the one that's being treated. Second, is it being used in a conventional way so that it's a one time a day, one time a week, 2 times a week, or whatever it is kind of drug, so it's being used in an appropriate way, not overdone, not underdone. Sometimes called appropriate or inappropriate kind of therapy. And then there are tools that also identify that it can be used for ways that are appropriate and for the particular diagnosis, but not greater than any diagnosis that could be used to treat it. And then, of course, there are methods to deal with pricing. There are tools that incorporate all of these so that people can check it for both cost and utilization. And it's also become very clear that we can find a significant amount of issues and problems for how they're being used, that they're being priced in an appropriate way, and in so doing, there are significant savings just for the use of that drug the way it is. Thanks so much. We'll talk about this more as we move on. Thank you.